Next, let's talk about MI complications. So, a person asks MI and what happens after day one, day seven, or after a few weeks. So this they will give you some scenario and they will ask you secondary questions. When do we see the waxy bed, um, or arrhythmias, and maybe they will give you the gross pathology and they will say there this is dark and what should we expect. So let me just give you a quick mnemonic for this. I've seen a couple of questions on TrueLearn when I was studying for my step 1 exam there too. So this is high yield as well. So basically this is the mnemonic for the gross color of the heart, the gross color of the heart. And just know these four things: dark, yellow, red, and white. How do I remember them? You're sleeping in a dark room, and then the alarm rings, someone turns on the light. The light is, of course, in this color yellow bulb, and the light hits your eye, right? And it looks red, especially in the dark. When you suddenly, when it hits your eye, it's gonna be red and you're gonna close them tight. So your eyelid's gonna close tight. So just know, dark room, they turn on the light hits your eye, and it's gonna be red color, and then eventually your eyes adapt and it becomes white. So just know, just divide this and just draw it out: dark, yellow, red, and white. In between, draw 3 lines, and then there have one day. This is gonna be day 7, and this is gonna be month, 1 month. That's it. So dark, yellow, red, white, 1 day, 7 day, 1 month. And just draw a 3 over here just to divide it. Okay. So let's talk about the first one. So I talked about the gross color, and next, after the gross color, we are going to talk about the scenery, certain things which are associated with it. So a dark scene, just imagine coagulative necrosis. And then there's Q wave, you're sleeping and it's quiet. So this quiet for Q wave. And you're gonna use this bed, and there's a sheet there, and it's made of waxy animal fur. So think about Q wave for quiet sleep, quiet place, waxy bed, and the alarm rings. So alarm ringing is gonna be arrhythmia. So again, dark, which means Q wave for quiet, waxy bed, and the alarm is gonna ring, and it looks like, and when alarm rings, it kind of vibrates, and that's similar to how arrhythmia is, for the heart. But after this, also just know coagulative necrosis. So just know that it's gonna be a calm sleep, so coagulative necrosis. Next, it's going to be NOMO. So that we know the alphabets, like LMN, NOPQ. So basically just know N and M. So N, continue the M, and then also the M. So we are going to have neutrophils from day 1 to day 3, and day 3 to day 7 we should be seeing some macrophages. And also just remember papillary muscle rupture associated that too. So it is helpful if you can just draw it out a few times and it should click. And the third one is going to be red, the color red. So red light, because the light is going to hit your eye and then you're going to close it. So it's going to be granulatomatous tissue, and that's going to be type 3 collagen. I just think about the third block, you know. So this is not associated with anything else. However you want to memorize this. So GT, granulomatous tissue, type 3 collagen. And here's what happens. You know, the free wall is going to rupture. It's going to cause pericardial effusion, and that's going to cause tamponade. So just as long as if you can remember this, that's going to help you a lot. And finally, we are going to go with the color white. So it's white, dense collagen scar. Imagine just a white scar. So two symptoms are associated. So a person sees the white scar, they dress themselves up to avoid the scar. So Dressler syndrome. So this is autoimmune reaction, fibrous pericarditis, which happens after a month. So this was, the GT was 7 days to basically 4 weeks. This could be longer than 4 weeks. So, and just know type 1 collagen because of one scar. So unlike GT, which is type 3 collagen, this is type 1 collagen. And so two things happen, as I said. So first is going to be the Dressler syndrome, and second is going to be true ventricular aneurysm. So I just imagine true ventricular aneurysm as the truth comes out about the person's scar. The person can hide it inside the dress, but then the truth comes out, truth for true ventricular aneurysm. So a question could be something like this. Patient has MI, and then it's been few hours. What do you expect to see there? So since it's been few hours, they are going to give you the answer choices. 1, coagulative necrosis. And then option B, it's going to be macrophages. And option C, granulomatous tissue. And option D, Dressler syndrome. What do we expect to find? If you're able to draw this out, you would know CN. So coagulation, necrosis, and that's it. So a patient has, heart attack, MI, and then it's been 4 weeks, and he is feeling, they're just going to give you, it's been 4 weeks, what do you expect? And they will give you the same choices, vaccine, bed, papillary muscle rupture, free wall rupture, or they will give Dressler syndrome. And basically, the exam is not going to trick you. They will space out the time so far where you would know, okay, so this is going to be the answer, Dressler syndrome, unlike macrophages at that time. So this is it. And sometimes it is flexible. You see this yellow and red. Sometimes they are merged together. So you may have to find other clues about it, about the question stem, and use the other choices to rule them out. And same goes. So we have tamponade and a couple of things. Sometimes they are just so similar together. So the exam will do their best, and you will get really good at it the more you do practice questions on these.